Hey, this is Dr. Matt Harris, just having a frank conversation with you about what you should be thinking about when you go in to talk to your surgeon about plastic surgery and what we're thinking when we talk to you. So, day in and day out, I get patients coming in who, in most cases, have a pretty obvious problem that they want fixed. In our office, it's mostly really heavy, droopy eyelids or some other aspect of their face that they're wanting touched up or operated on. But there definitely are patients who come in who are very borderline with any issues, maybe a tiny amount of extra skin on the upper eyelids or some real early lower lid changes with shadows and whatnot that they are bothered by, and wondering if they should have surgery to fix them. Sometimes they're insistent that they have to have the surgery, and oftentimes I am kind of thinking like, why, what's the underlying psychology here that's causing this patient to feel like they need to alter their appearance? In many cases, it's valid. Like they are worried about, it just progressing with age, and they're like, why should I wait? I'm gonna look, just slowly getting worse. So I might as well just get it done now. That's a valid concern, and oftentimes, if it's warranted, we'll go ahead with surgery. Other times, though, I like to just tell them, look, this is not an emergency. You don't have to do it immediately. Think about it. And, if you wait a few years, there's really no plastic surgical procedure that is going to be any harder to do. And you might see a better improvement, a bigger change, and be happier with the procedure. Sometimes patients come in with the tiniest little problem. They insist on fixing it. We go ahead and we do it. And they notice, well, it didn't make that much of a difference because there just wasn't that much problem to start with. And in most cases, I talk them out of it beforehand. I'll just say, let's just wait a few years and you're going to be a lot happier, because I know if they see a bigger change before and after, they're going to be more satisfied with the procedure. And so I think you just have to really be honest with yourself. Why am I doing this? Is it to please my impression of what other people want from me, or is it really for myself? And oftentimes, I think you can talk yourself out of a lot of things that you think, society or just the average person around you would do, when most people aren't really even noticing those issues in you. It's funny, I think most people think everyone's watching them and no one's watching you. They're all watching themselves. They're wondering what you think of them a lot more than what they are thinking about you. And little flaws you might find in your own appearance, most people don't notice those things until they get pretty extreme. So I think we have to really just take the time to step back and say, is this really going to matter? If I do this little change in my appearance, is it going to suddenly make everyone, treat me differently or be happier that I'm around? No, it's not going to do any of those things. You as a person are what they're worried about, not exactly what you look like. So having that in mind, there are definitely times when, procedures on the face can definitely make you more confident and take away some of the self-doubt you might have about some issue with the appearance. But, keep that in mind, that you have to have realistic expectations when going into what these procedures can do for you. And a lot of people can avoid a lot of expense and suffering from bad outcomes if they just take the time to really dive into what their motivations are for having surgery. Something that I'm happy to have a conversation with my patients about, and so let us know if we can help you out. Have a great day.